Hey everybody, I just want to take some time to introduce you all to the physical exam of the bovine. All right, and so a little bit different than what we would do in our small animal patients. We want to make sure that we get every aspect of the cow covered, and that includes doing the head as well. But it's really important in our bovine patients that that's what we want to do last, all right? And we know that it may be the most aggravating and irritating to the cow, so it'll just help her behavior and us working with her just a little bit better. But what we want to do when we come up, initially we want to look at this cow. And if this cow was not in a headlock already, we would want to watch that cow move. We would want to see, hey, does she have an arched back? How is she ambulating, right? And so by doing that, we can see, hey, exactly how is she doing? And just an outward, at a distance exam. All right, but what we want to do, she's in her headlocks now, we want to start up here on the point of her shoulder. And so we want to start by doing our pre-scapular lymph nodes, which we'll talk about each one of these subjects in the video following this one, just kind of showing you the order right now. Next thing we want to do, come up a little bit further back, we want to do our respiratory evaluation on the left side of this cow. Then we would want to auscultate the heart as well. Working around the cow, we would come back here and do a rumen evaluation, and depending on which lab section you're in, it may be more involved or not, but we want to do rumen motility, contraction strength and rate, and also rumen feel. Then we want to do some of our actual percussion, succussion, and ballottement. Again, we'll talk about that on the video a little bit later on. Finally, over here on the left-hand side, our prefemoral lymph nodes are right here. We'll take a look at those. Working around the cow, again, making sure we're doing this in the most safe way possible. Come to the back of the cow. You use the vulva to get a CRT and hydration status as well. Supermembrane lymph nodes would be here if this cow was milking. We would be able to feel those, but our cows here at LMU are not milking, so we won't be able to feel those lymph nodes in particular. All right, it's a great opportunity to also look at the back of the claw or the back of the hooves to see if we have any lesions back there as well. Working around the actual right side of the cow now, we'll do our prefemoral lymph nodes again on the right hand side. We would do percussion over on the right hand side as well. We would feel prescapular lymph nodes, again right sided respiratory exam, and we would listen to the heart on the right side as well. Lastly, what we would want to do is we would actually palpate the trachea of this cow, see if we could elicit a cough, and it depends on which side that she is in the headlocks. Again, making sure that we do not reach through the bars. To do that, again, that's putting us in an unsafe position. In this cow, we would actually want to come up towards the head. Again, put us in an area where we'd be a little bit safer. Lastly, what we want to do with the head is actually do our oral exam, and we would actually do hydration status again in the mouth and on the eye as well. And that is kind of putting together everything that you all would need to do a physical exam of your bovine patient.